while staying at home, and that includes our veterans. We're joined now by Dr. Neil Evans, Chief Officer of the Veterans Affairs Office of Connected Care. Dr. Evans, thank you so much for being with us today. Can you go ahead and tell us a little bit about those telehealth services that are available to veterans right now?
Sure. VA has been a leader in telehealth for well over a decade, and just even last year, more than 900,000, nearly a million veterans received a portion of their care through telehealth. Really, if you can think of the clinical specialty, in more than 50 clinical specialties, we're able to deliver at least a portion of that through telehealth. And we do that through video visits to patients in their homes or local communities. We're able, in our clinics, to connect patients through video to a specialist at one of our main medical centers, and that specialist is able, with special equipment, to do a full examination, listen to the heart with a digital stethoscope, look in the eyes, for example. And we even use telehealth to augment the care in our intensive care units, where we take care of the sickest of patients within the VA healthcare system. So it's really something we use across the spectrum. But during the current pandemic, the real focus has been on our ability to deliver care into the home, in particular using video visits.
And when we talk about telehealth here, what are some of the appointments or care and treatment that is most ideally suited to a telehealth appointment?
Yeah, I think for the most part, we see a lot of care delivered for mental health care, mental health counseling, for example. Also primary care, connecting with a primary care provider to ask a question. But then other specialties like endocrinology, managing diabetes, getting advice from a nutritionist, connecting with a social worker, really across the spectrum. Not everything can be done through telehealth. Sometimes there's a need for a face-to-face visit, but certainly the start of a conversation can always happen through telehealth.
Absolutely. And during these stay-at-home orders, we're getting that message that folks are safer in their homes. Have you seen the demand for these telehealth visits increase?
We certainly have. We've seen over an 8-fold increase in demand and utilization of our video visits to the home. We were doing on the order of 1,500 to 2,000 video visits a day in the VA healthcare system before the pandemic, and now we're doing 16 to 18,000 visits a day.
Yeah, and I would imagine that as the demand goes up, you see more people asking for this. Final question for you here. Can you tell us a little bit about what you're doing for those veterans that may live in areas that are rural, where the technology access barrier might be higher to getting these telehealth services?
That's right. We want all veterans to be able to benefit from the technologies. That's really important. We have several programs that are helping us make sure that we're reaching out to those in rural America, including a program where we can provide tablets to veterans, internet-enabled tablets that they can use to connect to their providers through telehealth. For those who have significant health conditions, we're able to, for our VA Video Connect platform, actually, we've partnered with Verizon, with T-Mobile, with Sprint, with TracFone, and those cell carriers don't charge data charges when patients connect on their cell phone to VA for their VA healthcare visits. So quite a lot that we're doing to make sure that we're reaching out to all, not just those who have access to technology and broadband internet.
Dr. Neil Evans with the VA, we thank you so much for your time this day, and thank you for all you're doing for our veterans.
All right, thank you, Todd.